the four common diseases are rising costs, inefficiencies. I'll summarize them first and then I'll explain them. And then lack of access and also unsatisfactory quality in healthcare. So the cost one means that the cost of delivering care is rising approximately twice the rate of GDP in many countries. So it's an unsustainable increase which is hitting hard at the economy of many countries. And the cause of that is not just the cost of the treatments, but also the silver tsunami issue, as well as the incidence of chronic disease in the aging population. So the need for more health care. In terms of inefficiencies in healthcare, the fact that we're not IT enabled means that very often the scheduling of proper procedures and appointments is an inefficient process, and a lot of time and expense is wasted in that process. And also the payment. Doctors spend far too much of their precious time processing paperwork in order to get paid for the care that they deliver. And then lack of access is the issue where in many areas where it's a rural population, there just aren't enough doctors to provide quality care to patients. And then the quality disease is focused on the fact that doctors are expected to be magicians in many cases, to treat patients about whom they don't have adequate medical history knowledge. The patients themselves may be ill-informed about what medications they're taking, and so the doctors are left many times to make an educated guess. So if we can overcome that, and we could avoid many mistakes that are otherwise preventable. I'm talking about here are on the level of information technology. One could argue there are other treatments at the systemic level that would also be valuable, but in terms of the use of IT, the four common treatments are, first of all, digitize health information, make it electronic so that it can be shared via computer systems. Secondly is the sharing. Connect the systems together so that you can gather an electronic longitudinal history of the patient. The third is management of patients using IT. So chronically ill patients, you can actually work with them via online tools. You can have better communication electronically via secure email between doctors and patients. You can also have devices connected to IT systems in the home which support patients and manage their disease. And then the last treatment would be what I call empowerment. So actually putting the patient more in charge of their health, giving them more information, enabling them to interact more dynamically with the physician and their care plan, and provide feedback into the system that validates or supports that the treatment they're being given is actually working. I think the chairman of our company has recently commented, GE Healthcare views the healthcare IT industry as being in the first inning of a 9-inning game, if you use the baseball analogy. So we are very excited. We think we're on the threshold of really widespread transformation in this industry. We expect to see a huge amount of innovation and a lot of dynamic change within the healthcare IT industry over the next few years. And we do think that this is a time where there's a perfect storm brewing in terms of government interest in this, funding being available, consumers having access to tools that empower them, and also the availability of standards and technology to make all of this happen. I think we just have to stay committed to the goal and not get bogged down in the details, because this is not easy. It's hard work to make this happen. So we mustn't be discouraged by minor setbacks. We have to persevere with the vision on what the goal is and what the benefits will be.